Hi, welcome to Kitchen Conversations. Did you know that every 3 minutes in the United States, someone has a brain attack or a stroke and they die? Now, I think dying's bad enough, but I know that stroke is the leading cause of disability in the United States. You have one of these things and then you get to sit in the rocking chair, nursing home, rest home, wherever for the rest of your life. I don't want that to happen to you, and so today I have invited a really important guest to be with me, and I want you to welcome with me Joanna Yang.
Hi.
Hi, Joanna.
Hi.
Now, Joanna, you're a registered nurse.
Yes.
And you're more than that.
I'm a nurse practitioner, work with stroke patients, and I'm a stroke program coordinator here in Loma Linda.
So you are not only a nurse, but you've taken advanced training, and now you're focusing mostly on stroke patients, and
Yes.
you've put together a stroke center.
I work with many others to put it together.
So we have a team here to take care of you, and there's teams like this all around the United States.
Many hospitals, yes, do have teams like that.
Great. So what I want to talk to you about, and I know there's a lot of confusion out there on the part of our watching audience. My mother used to be very confused. She would say heart attack and stroke and not necessarily know the difference. So what is a brain attack or a stroke? What is it?
Okay, so stroke is a brain attack. What happens during a brain attack is, I want to show you on this model, a blood vessel in the brain is blocked by a clot or a thrombus. So that area of the brain starts to die once they don't receive blood supplies. In a heart attack, that's what happened to the heart muscle. So patient may have pain in the chest, they may have numbness on the arms, they may have pain in the arms, but with a stroke, a lot of patients don't feel that. They just have some weakness on one side, they have some trouble talking, they say, okay, I'm just gonna go to bed and it'll all get better. No, you gotta call 911. It's an emergency.
So, essentially, a brain attack, like a heart attack, is a little round clot that gets stuck in a blood vessel. Plunk, there it is, stuck. Clots, just like on your skin when you bleed, they make a little thrombus and they get together and they stop up the bleeding, but this is done inside of a blood vessel.
Correct. I'm going to show you this. This kind of demonstrates a blood clot. Hazel, you can point which one is a thrombus, what is an ambulance.
Alrighty, so here is a vessel and a stuck blood clot, you might hear your doctor call a thrombosis or a thrombus. If that blood clot lets go and starts moving and traveling into littler and littler vessels, in some place it will get caught.
Exactly.
And that little moving one is called an embolus or an embolism. So you may have heard of people having had a pulmonary embolism, which is a little traveling clot that gets stuck in the lung. You have cardiac embolisms, which is a traveling clot that gets stuck in the heart. And we have embolisms that travel up and get caught in our brain.
Right. Look at this ambulance get caught in this blood vessel and there's no blood flow to the area. And I'm going to show you this. And that's the cause of a ischemic stroke. Look at this picture.
Let me hold this here tightly there. There we go.
So look at this picture. This is a ischemic stroke. A blood clot blocks a blood flow in an area to the area of the brain. So this area turned blue. Those are an area of stroke.
So if a clot travels along, because every part of our body needs blood.
Exactly.
Every part of our body has blood vessels. So here comes this little traveling blood clot, gets stuck, and beyond that, it's kind of like the freeway or the highway. If there's a traffic accident on the highway, suddenly all of the traffic is stopped. All the traffic is piling up behind the accident. There's nobody on the road ahead of the accident. Therefore, that part of the road that doesn't have any traveling on it starts dying. How fast does this happen, this dying process?
Very fast, in a few minutes.
It starts fading away in a few minutes. And every part of our brain is really important because different parts help us function, right?
Right. So if you have a blood clot in a very important area of the brain, then you can lose your speech. You can lose your arm movement. You can lose the sensory. You can't feel it. You may not be able to see on one side. So it's very important. If you have any symptoms like this, what do you need to do? Call 911. Get to the hospital right away.
Okay, now you showed me this one, you called it ischemic, and I know that means lack of oxygen, but it's a really million-dollar word. So we're just going to have stop traffic stroke.
Okay.
There are other kinds of strokes we can have that people may have heard about, and I'd like you to talk about them. And I know we call them hemorrhagic, or the word means hemorrhage or bleeding.
Correct. So there is another kind. It's called hemorrhagic stroke. What it means is bleeding inside the brain or in a space called subarachnoid space in the brain. So you may heard someone who died from an aneurysm, ruptured aneurysm. That is one kind of hemorrhagic stroke.
That bleeding stroke.
Exactly, a bleeding stroke. So an aneurysm ruptured and there's blood in a subarachnoid space. That is a hemorrhagic stroke. And there's another kind. It looks like this. Bleeding occurs inside or among brain tissue. So bleeding may occur inside the brain. And you may know some people or relatives who have sudden onset of headache and then right-sided weakness, and then they fell down, and then they become unconscious, and they go to ICU. It's a serious kind of stroke.
Well, one reason we know that there's problems in the brain with bleeding is the brain is like, you can see here, and it's covered with a very hard shell called your skull. So if something bleeds, there's no place for swelling. If I hurt my arm and it's bleeding inside, my arm will swell a little while, and I can maybe be okay. But in this situation, it puts pressure real rapidly against that really bony skull, and then I start having some symptoms.
Right, you're absolutely right. There's not much room for the brain to swell. There's not much room to accommodate those extra blood in your brain. So that will cause severe problems, such as headache, weakness on one side. Patient may become comatose. It's really serious. In this case, again, call 911 and go to a hospital.
So let's give me some more information. First of all, we've talked a little bit about the thrombus causing a stroke, but what other kind of things cause problems? Now, I mean, I'm just walking along, living a happy day, and get a stroke. Was there any risk factors? There should have been some things that caused this to happen that I should have been maybe aware of that, wow, maybe I'm setting myself up for a stroke.
That's a very good question. I'm going to show you the stroke risk factors. There are many risk factors. So patients who are at risk of stroke, if you want to know, am I at risk of stroke, I want to ask you this question. Do you have high blood pressure?
Now, what's high blood pressure?
High blood pressure means your blood pressure is higher than normal. Right now, if it's higher than 140 over 90, it's high blood pressure. You can have it checked in a store, or you can buy a blood pressure cuff and measure it yourself.
So our blood pressure should stay less than 140 over 90.
Absolutely. A lot of people have high blood pressure. They walk around, they don't feel bad. So like, okay, I don't need to take medication. No, blood pressure is very important to get it under control.
And remember, your blood vessels in your brain, in your heart, in your body are a lot like, I think of them as garden hoses. So you have a garden hose, and it normally carries regular water from your faucet at a regular rate. But if you have a high pressure, like suddenly the city does something and there's really high pressure in your hose starts coming apart, or it pops off. So it's the same kind of thing. If I'm pushing really high amount of pressure on the inside of my blood vessel, bad things can start happening.
Absolutely. The blood vessel can rupture and causes the bleeding type of stroke. Or over time, with high blood pressure, it damages the blood vessel wall, and that can cause ischemic stroke. So definitely get the blood pressure under control.
So if I have a damage in my blood vessel, my body does what it always does. It makes a clot. Let's fix this. And then the clot moves or gets stuck. Okay, so high blood pressure is one of the biggest problems of causing stroke. What else causes stroke?
So if you have high cholesterol, that definitely puts you at a high risk of stroke.
So you should be having your doctor regularly check your cholesterol levels.
Yes, if the cholesterol level is high, you got to take the cholesterol medication. I want to show you a picture of
Let me hold that one
this.
for
Want
you.
to hold that one?
Yes.
Okay, so when they have high cholesterol,
Now,
look what
we're looking at
happened.
the inside. This is like you cut your garden hose right through the middle. So we're looking at a vessel. Looks
Yes.
just like the garden hose, cut through the middle. Okay.
Exactly. The vessel should be wide open like this. But look at this blood vessel. Half of it is already closed up because of all those cholesterol plaques. So the blood can only go through half of these blood vessels. Imagine then you have something stuck over
There.
here, then the blood vessel is going to be closed off,
pretty
and then you
soon-
can have a stroke.
We have the freeway shut down. The super highway is closed off. Part of it's closed off by plaques or little fatty cholesterol things, and then the other is stuck with a clot. Wow.
Right.
So back to this one. So now I'm going to watch my blood pressure, and if my doctor says I should take blood pressure medicine or eat a little different, I should pay attention.
Absolutely.
I'm going to listen to my doctor and find out what my cholesterol levels are. And is it fair for me to ask and write down what my cholesterol levels are?
I think you should. You should keep a record of the cholesterol and make sure it's going down to the normal level.
Because it is my body. So I
Absolutely.
should be watching it. Okay. Wow, here we have heart disease.
So if you have a heart disease such as irregular heart rate, what we call AFib, that definitely puts you at risk of stroke, because when your heart is pumping irregularly,
It's kind of quivering there on top.
exactly, and blood clot can form inside the heart, and it can travel to the brain and causes a blockage in the blood vessels, as we discussed earlier.
This actually happened to my mother-in-law, so I do know that that happens. Yeah. Okay, here's another one. Diabetes. Diabetes means I'm going to have a stroke?
Diabetes damages blood vessels over time, and
Okay.
it causes narrowing of the blood vessels, and it damages the blood vessel walls. Just like the picture we showed earlier, this blood vessels gets damaged with diabetes over time, and it puts you at the risk of forming a blood clot here when the blood vessel is damaged over time with diabetes. So the best way to lower the risk of stroke is get the blood sugar under control.
Well, there's a lot of things going on here with my blood. I have to get my blood pressure down. I have to get my blood cholesterol down. I have to get my heart blood disease down. And I have to get my diabetes not to hurt my blood. And that's taking my blood sugar down.
Right.
Oh, here's the next one. This is a good one. Smoking. You mean I can?
So smoking damages the blood vessels really, really bad. It increased the stroke risk by 11 times.
So if I'm smoking, if I smoke and you don't smoke, 11 times more chance that I am going to have a stroke than you.
Yes.
Okay, I quit.
Stop smoking is the most important thing to prevent stroke.
Okay, next down here we have heavy alcohol use.
Heavy alcohol use meaning more than 2 cups per day for men, more than 1 cup a day for women. That's heavy alcohol
Okay,
use.
so 2 glasses of anything to drink a day
Right.
for men, 1 for women. Oh, so what if he's a skinny guy and I'm a fat lady?
Doesn't matter.
Oh, it doesn't matter. Okay, I just thought I'd ask. I thought I'd ask. So really limit your use of alcohol.
Right.
Physical inactivity and obesity.
Basically, that puts you at risk of all kinds of disease, not just stroke, but heart problems. So get moving, get regular exercise, and lose weight.
Get your weight to the normal levels would be
Right.
very helpful. And that will help with your heart disease, and that will help with your diabetes. I know
And
that,
blood
too.
pressure.
And your blood pressure, yeah. And you've already mentioned the atrial fibrillation.
Yes.
That's that irregular heartbeat that you actually can feel.
Right. If you feel your heart rate,
And it isn't regular.
regular.
It kind of pops all around. You probably have atrial fibrillation.
you should have your doctor checked.
But you sure need to check. All righty. And then last one is if you have family history.
Right. Like if your parents had a stroke, your brother or sister had a stroke, that definitely puts you at risk of having a stroke.
Well, that's a pretty big list. So, talking a little more about stroke. If I'm just at home by myself, how will I know what's happening if I'm having a stroke? I know with a heart attack, we've talked a lot in this other programs about the heaviness of the chest and this arm, maybe having pain or maybe some jaw pain or some sweating. Do I have those symptoms when I'm having a brain attack?
So when you're having a brain attack, you may not have pain, although some patients may have headache, but most of the ischemic stroke patients don't have headache. You may have weakness on one side, like we talked. You may have facial droop. You may have trouble talking, but you don't have pain. So a lot of people would just go to bed. Like my aunt did. She had a stroke when she was 81 years old, and she was a nurse. She thought, well, I'm just tired. I'm going to just go to bed. The next day, the symptom got worse. So her right arm, her right leg was weaker, and she had trouble talking, and she had a facial droop. So if you have any of those symptoms, think about stroke. Call 911.
Okay, now the reason we want to act fast, and that was the face changes, the arm drifting. So if you have someone in your home and you're not sure if they're okay, have them stick their arms out, right?
Right.
And if they can't hold one up, it just kind of keeps falling away.
I would call 911.
And if their speech is slurred or they sound kind of like they have a lot of marbles in their mouth, right?
Or if they have trouble finding words, that's the problem.
Right. Finding the words. They can't not necessarily remember your name, but they can't remember to call this a cup.
Right.
Then you think something's not right here. Now, why is it so urgent that we get you in fast?
Oh, that's a good question, because right now there are treatments. There are medication we can give to the patient, but it has to be given within a few hours. So if you don't get to the hospital fast enough, you may just be out of the window. So there are limited time that we can treat. There's IV medication, and there are other procedures that we can do. But you got to get to the hospital right away. And it's important to get to a stroke center.
Okay, now I know we were talking about here the arm and the face, and that's FAS. And the last one that's on there says time. How much time do I have from the time I either feel this or, my goodness, I go home and there's my mom sitting in her rocking chair and she's just not normal. I mean, I know something's wrong. You know, she talks and her cheek puffs out and her arms aren't even. How much time do I have until this medicine will or won't work?
That's a good question. So we can give the medicine within 3 hours from the time stroke start. So you really have very limited time. And we recently expanded the window to 4.5 hours from the time the stroke symptom starts. Really, if you find grandma on the chair with symptoms, she may have it for a while. So you got to take her to the hospital right away. And there are other treatments such as intra-arterial TPA that is given by an interventional neuroradiologist. That can be done within 6 hours of last time the patient was seen normal. And there are other procedures such as clot retriever devices that many centers are started doing. Nevertheless, not all of this has to be done within certain time window.
So fast is important. Getting you to the hospital rapidly, not taking a nap, not thinking, oh, grandma just is having a moment. Now, I'm always just talking about grandma, and I sometimes think that this is a disease of old people, but that isn't the truth, is it?
That is not true anymore, because I have seen many, many young people with strokes. I've seen patients have strokes in their 20s,
wow,
in their 30s, in their 40s, and I've seen more and more young people with strokes. Remember, they don't just have the face, arm, speech problem. They may have other problems. They may have dizziness. They may have other symptoms. And the younger patient in their 20s may have problem with blood clotting problems. They may have clotting problems. They may have high blood pressure at a very young age. They may have diabetes all their life. I've seen patients in their 40s has huge strokes. So if it's a young patient that has the symptoms, think about stroke as well.
Yeah, just because there's an age factor here, we shouldn't think that, oh, well, they're too young to have this happening to them.
I've seen 19-year-old with stroke.
Wow. Wow. That's really true. And, you know, we do know that a lot of our patients have diabetes at a young age. We have some very obese young people. And then they always have some of the hemorrhagic ones where you have aneurysms that have always been with them, too. So when you see this, you see these changes in somebody, even if you don't know when it happens, you want to call.
Yes, you want to call because there may be treatment that is not a clot buster medication, but there are clot retriever procedures that they can do that can be done more longer with a longer window.
And that's important because we did mention right away at the beginning of the show that this is the #1 cause of disability.
Yes.
And I don't know. I want to live my life full every day, and then I want it done. I don't want to dwindle away and fade away. I want to have that joyous living of my life. And the idea, I had a dear uncle. He lived 11 years in a wheelchair, mostly in a nursing home, and he had what was called expressive aphasia, so he couldn't say what he needed to say. I am almost positive he knew what he was thinking.
Yeah,
And
it's
that
so
was
frustrating.
so frustrating. It was so difficult. We didn't know what to say. He was trying, and then he'd get upset. And so if we can do something to treat this, that's phenomenal.
Exactly. So I've seen many people with disability and severe disability, just like your uncle. They couldn't talk, they couldn't move the right side, they're on the wheelchair, and if they had stroke at young age, such as 30, there's many years disability. So in order to prevent that, we talked about control the blood pressure, the cholesterol, get treated for the heart disease, get your diabetes under control. Then you can have a long life without disability.
And that's what we all want, isn't it?
Right.
So you have mentioned a word, it's come around a couple times now, and that's the word stroke center. Now, is every single hospital in North America a stroke center?
Not every single hospital is a stroke center. There are about 600 some hospitals in the United States are certified stroke center. So in order to be certified stroke center, I have a list of things they have to do. There are a lot of standards you really have to meet. So Loma Linda is now a Joint Commission certified stroke center, thanks to many people that put their effort into this. So basically, to become a stroke center, you got to have hospital support, you got to have a stroke team that's basically ready to go any minute. Whenever there is a stroke activation, they arrive within a few minutes.
So it would be a larger hospital that would be a stroke center. A small hospital with probably 30 beds or less that'd be out in the middle of the United States and in Kansas or in Nevada somewhere might not be one.
Right.
Because they're a small hospital. They can't have all of these people on staff. Just
Right,
doesn't
so
happen.
if they're not stroke center, if they know how to transfer a stroke patient to a stroke center, that's what they should do.
So if I live somewhere out in the country, I have my stroke, I'm going to dial 911, they're going to take me quickly to my little hospital, and I'm there, my husband's with me, I want my husband to say, I need Hazel being taken to a stroke center.
Right. Many counties have a transport system to transport stroke patient to a nearest stroke center. They
So
can
they'll come in with
airlift.
a helicopter and take me where I need to go.
Right.
Hey, free helicopter ride. No, it's not. All right, what else do I have to know that I am to be a stroke center? So, because I want all of you to know and find out where your nearest stroke center is. That's your assignment for tonight, okay? Find out where your stroke center is. So tell me some more, Joanna. What else do they have to have?
To become a stroke center? Okay, so to become a stroke center, the hospital has to have protocols. They have to have order sets. And then you gotta have to train all the doctors and the nurses, the patients, and the community about stroke. Then you gotta have neurosurgery available. You gotta have stroke units and CT, MRI abilities in basically 24/7.
So you have specialized trained nurses, you have doctors that are specially trained, you have the MRI and the CAT scans and all of those machines there, you have surgery ready to go if you need it.
Right, if you need
Terrific.
it. Right, and also lab available 24/7, and we also have a quality improvement process.
Okay, so we're looking at it, we're improving it, and we're getting it. So I think my takeaway from all of this is if I didn't live next door, no matter where I live, I need to know where my stroke centers are.
Yes.
I need to know my symptoms, and I need to know how to get to them. And if I went to a small emergency room and they just sort of sat me there, I would hope that somebody said, have you thought about taking her to a stroke center?
Right, so don't wait in the ER. So if you think you're having a stroke, say the word stroke. It will alert the nurses and
That's right.
alert the doctor.
Because some emergency rooms are terribly busy. And so if I just walk in and I go, oh, I have a headache, they may sit me in a chair because they have worse patients. They have patients that are, bleeding and something else, or they think they're worse. So I need to say, I think I'm having a stroke.
Right. So
yeah.
Say it. If you have a headache and you have weakness on one side, you have your facial droop, your leg is not working, that may be a stroke. Say the word stroke.
And people will pick that up and take care of that.
Right.
Oh, that's really great. You have given us some really good things to think about. Are there one population that's more prone to stroke than others, or is this pretty much, no matter what culture I am, no matter where I live?
People approved for high blood pressure and diabetes are at higher risk of stroke.
Risk.
Right.
Yeah, and we know
Older
that
people.
diabetes is in the rise in the United States. A great deal. Mm-hmm. So that 4 hours is terribly important.
Right. So we do 4.5 hours for IV TPA, but at the time of transportation and the time that you found your relative, so you really don't have much time to take your loved ones to the hospital. So call 911. Certain EMS systems have a stroke center diversion system, so they will take the possible stroke patient to a stroke center directly.
So they would take you to the best place that would be good for you.
Right.
Oh, this has been so important. And I hope as you're there at home today that you have written down these symptoms and come to our website. We're going to post these here, but make sure you're acting fast. Watch anyone whose face has changed. Really notice that. It could be a colleague who's walking down the hall. Watch and have them put their arms out for you. See what happens if one drifts down or their leg seems to be dragging. Please pay attention to that. Watch their speech. Are they having trouble with words they never had trouble with before? Are they slurring their speech? They're just not acting right. And then notice, what time was it that you saw that? Because once you have the time, we want you to get to the hospital within about 4 hours. Not to the hospital, you need to be treated within 4 or 5 hours because we want to use our clot busters on you. We want to get you to interventional radiology, which I know is a really big word, but they watch where they're putting things and they have little tools that can take the clot out. And then, of course, really be good with your risk factors. Watch your blood pressure. Control your cholesterol. If you have heart disease or diabetes, work really close with your primary care practitioner because only you can take care of your health. And we want you to live a great, full life. Enjoy your day. Live abundantly. Live a long life. And until we meet again, take care of yourself.